Walker, MedPage Today, reporting from Washington, D.C. I'm outside of the Ritz Carlton, where America's Health Insurance Plans, the insurance lobby, is having its annual meeting. This event has brought hundreds, maybe thousands of protesters from labor groups and religious groups who marched from Dupont Circle about a half-mile away to the hotel to protest what they say are insurance industry abuses.
The crowd met in Dupont Circle Tuesday afternoon, where they joined former Vermont Governor Howard Dean before marching to the Ritz Carlton. There, I spoke with Dr. Terence, a primary care physician in Washington, who is also undergoing treatment for thyroid cancer.
Having seen it both as a physician and a patient, I pretty much know the ins and outs and know that serious reform needs to be made. I just got a bill for an injection that costs $2,800. I had to have 2 of them. That's more than my surgeon got paid. I had thyroid cancer to remove my thyroid. So when you've got medications costing more than what the physician's getting paid, and it's not a fancy. It didn't take them. You know, they didn't have to go to Mars to develop this particular synthetic hormone. So it's absurd. The markup is extreme. The people who are actually the nurses, the doctors, the therapists, for the most part, are not getting the money. It's the profit at the top.
The crowd marched from Dupont Circle to the Ritz Carlton Hotel, brandishing wanted posters with the names and faces of insurance executives. I caught up with another doctor, Luella, who is also the president of Service Employees International Union's Committee of Residents and Interns.
I'm here today because our member physicians and safety net hospitals across the country and all the other physicians organizations we work with realize that something's wrong with our system and want something to be done now. It's really unfortunate when, many of our physicians who have worked really hard to learn how to train, you have to call to get permission from an insurance administrator on whether or not to order a test, to give care. When the medications that we prescribe, our patients have to get permission to see if they're covered by their insurance. There's just a lot of extra hoops that we consider barriers to providing good health care.
Insurance executives did not come out and talk to the crowd, but they did issue a response of sorts in the form of a national ad that AHIP launched just hours after the protest.
What's inside the healthcare cost pie? Some in Washington say it's all health insurance. But health insurance is one of the smallest slices. Health insurance companies' costs are only 4% of all healthcare spending. Doctors, hospitals, medicines, and tests are the biggest slices.
But the hundreds of protesters on Tuesday didn't seem to care about that message. From Washington, I'm Emily Walker, MedPage Today.